Thanks a lot for tuning in to this virtual presentation for the SMIT conference. And without further ado, let me tell you a little bit about my project. So for the last bit of time, I've been working on designing and testing instrumented hip implants that can sense force exerted by soft tissues, such as muscles and fat, and the orientation of the leg or the implant during surgery. So this is important, and I'll get onto it in a sec. But first, let's do a crash course on hip replacement. And here's a diagram of basically the bones in your body, and this is the hip and the leg bone, the femur. The joint eventually would wear out due to age, disease, or even just an accident. And now when it's worn out, you're usually in pain and you don't really want to walk. So through the advent of modern medicine, people have been developing artificial joints like this to replace human joints over the last few decades. Now, these things these days can last well over 20 years. So the durability of the material has improved quite a lot since its conception. So when you get a hip implant, you can stay awake and chat to the doctor. And that's actually true, but before the surgery, the doctor would use X-ray images to plan the size and the angle of the neck of the implant to suit each particular patient. But during the actual surgery, the doctor would first use a trial implant, which is this one, made of modular parts, to insert it into the femur and to give it the correct shape, or the femur cavity, I should say. And while the trial implant is in the hip, the surgeon will move the leg around through a series of range of motions to determine the right tightness and the right balance of the soft tissues. And after he or she is satisfied with how it feels, and notice how I use the word feel, then the permanent implant would be inserted into the patient. And there is basically an entire cabinet full of every single possible configuration of, the head, the neck, and the neck angle, and the stem size, and the liner, and also the cup size. So you got to pick the right one to fit into the patient on that day, on the spot. So unfortunately, a few things haven't improved over the last few decades are the fact that this is more of an art rather than a precise measurement of the patient's body and the precise insertion of the implant into the patient. So we really rely heavily on the surgeon's feel and perception of how well the implant fits into each other, or fits into the person. And as you can imagine, this is highly subjective and dependent on the experience. And also the implants have largely remained unchanged. They do the job well, but there hasn't really been any breakthroughs in terms of bringing in new technological advancements. So it'd be really nice to have a trial implant that tells the surgeon how well tensioned the soft tissues are and how well everything is fitting together before they put in the permanent implant and close you up. Because a well-fitted implant versus a not so well-fitted implant is the difference between not hurting anymore from arthritis, for instance, to running and jumping around, or even riding a bike, for example. And especially these days, patients getting these replacement procedures are getting younger and younger, and therefore they are demanding much more from these implants due to their more active lifestyles. So we're really having to push the envelope of tissue balance a bit further. And normally a slight overtension is more conservative, but that brings about muscle fatigue. And on the other hand, undertension gives a risk of dislocation. But anyway, this is now quite a common procedure. There are tens of thousands carried out each year just in the Netherlands alone. And obviously, as you can imagine, the costs do add up quite quickly. So it'd be nice to have a technology that improves for all these stakeholders. But currently what's out there in terms of force sensing is quite limited, as you can imagine. There is a one-off study by Bergman and his friends who uses like strain gauge type sensors that are embedded into the neck of the permanent implant, which is this one. And they've given that to about 10 people. And their strategy is quite different compared to ours. They wanted to measure the kind of forces exerted on the joint during everyday activities, and not really for improving on the surgical outcomes, and not used obviously during surgery. Now the other ones here, they're basically FSR sensors that basically can be applied on the liner or in the head or on the interface between the two. But of course, their aim is also different from ours, more like for exploratory type studies or even trying to predict the wear of the components. So I think what we're trying to do here is quite niche, obviously. So let me show you a bit about what we've done right now. Now this is the first design iteration that we've made, and it's actually been made by one of our students, Dieter. And this is a 1 degree of freedom sensor that acts in the axial direction of the implant. Now it's very simple, actually the simpler the better. This device uses Hooke's law. We use a rubber O-ring as a deformable material sandwiched between a magnet and a Hall sensor. And now basically the output of the sensor changes based on how close the magnet is to the sensor, and that's obviously related to how much force you're compressing onto the O-ring. And the next iteration of the device, basically we've given 2 extra freedoms, so we can now sense force in 3 directions. And at the same time, we're trying to keep the design as simple as possible because, from experience that things will go wrong, for instance, during a cadaver study. So you really want to keep things not complicated. And it's also easier to make and also easier to calibrate. Now, I did take into account the hysteresis and stress relaxation coming from the O-ring as a polymer material, but that can be accounted for more or less during the processing of the data. So I'm not too worried about that because at the moment we're not measuring anything at all compared to this. I've also added a IMU basically to measure the spatial data that can be coupled with the force data. So I think that's really cool. So you can have the force and the movement of the leg. You can replay that in the computer later. So we did actually, we did 2 cadaver studies, one for the OneDOF and the other one for the ThreeDOF. And, we've gone through typical range of motion tests that the surgeons normally carry out by manipulating the legs. We did 1 cadaver for the OneDOF and 2 for the ThreeDOF. And initially we actually had 3 planned, but the condition of the 3rd cadaver wasn't satisfactory to our surgeon Brian. So hopefully we'll get to do more experiments in the near future when this whole work from home thing finishes. And also here you can see all the trays, all the different sizes of the cuffs and the heads and stems and all that, just needed for 1 operation. So really impressive stuff. Let's get into data. Here is a sample of the OneDOF test. And now as you can see, when you rotate the leg, you can see the muscles tension quite differently. And I might say that the patterns are quite distinct. And the forces that we're looking at around a base is about 20 to 40 newtons, and they peak at about 100 newtons. So these are the values that, we first found out that this is the value that we're playing with. And now moving on to the ThreeDOF data, let me show you some animations. Sorry, they're not really synced to each other, but also quite similar in terms of the magnitude of the forces here. But this time with the spatial data as well, we can actually match the direction to the forces, and I think it's really cool. And we know exactly at what position the leg is or was during that range of motion test. And they are distinct force and angular velocity patterns. And therefore, I think it's imperative to capture the entire picture. Just using, if you have a sensor that just uses the angular velocity, that's probably okay, but we could also complement data with accelerometer and magnetometer data to make it more accurate and reduce drift as well. So here's the other half of the same data. You can do away with the magnet field data, but you'll be relying on dead reckoning. So it's a nice addition. But I guess you can also use the pattern to draw up a set of rules or guidelines for future ROM tests so that the tests carried out would be consistent between each other. And now briefly, I've just shown you a few samples, obviously. So if you want more data, you should read the paper. Hopefully it'll be submitted soon. Now we can observe, during the data that there are quite clear patterns and the forces coupled with the orientation data. Now that's not been seen before, I think. Now I think that the ratios between the data, for example, between the peak and the trough, and how that plays out between each predetermined location or position of the range of motion would be very important to compare and to understand what is objectively a balanced hip. Now, also, I think the next step is to devise a predictive model to tailor the implant configuration for each patient. So therefore, we're personalizing this to a further step. And also, stress relaxation of soft tissues is or will be much greater than the device components themselves. So you kind of have to think how you will interpret that data. So it's not really wrong data, but because that's just the way it is. But I think it's how you will look at the data in that ROM test, or you're comparing between different replicates. And also, I know that the in situ ex vivo experiments would be vastly different from in vivo conditions. And this is a segue to my past paper that I've done a while ago, so you can read up on that as well. And just let me summarize here quickly. In this work, we've designed a prototype measuring device that can basically measure the force and the orientation of the implant in the body to the Johnson & Johnson implant design, and eventually it could be used during clinical settings. And I think the ThreeDOF information that we've shown, I think that's really valuable to the understanding of a balanced hip, and also to draw up a criteria for balanced tissues, as well as to improve on future implant geometries possibly. And we also need to design the device to be suitable for use in clinical environments and sterilization. And finally, not only can surgeons benefit from improved learning, patients can also benefit from a better hip, and obviously an improvement to their quality of life. So that's all for now. Thank you very much. And I also like to thank these guys for working together with us and providing the opportunity for this work to happen. Don't forget to like and subscribe. No, please send me an email if you have any questions. And I hope to see you guys next year in person. So take care, stay safe, and thank you very much.